Welcome back. Welcome back. Thanks so much for joining us. We're talking in this segment about health insurance. And last year we talked with Vince Least about what they were doing at North Arkansas Regional Medical Center. And there's an event that's coming up. We have Debbie Johnson here to talk also a little bit about an event that will help you understand more about your insurance needs, and an actual event that's coming up that you want to talk about how to sign up and some information on helping people.
Yes, we're having a sign-up event for the Marketplace Insurance on January 12th from 12 noon till 6 o'clock in the evening. There are still a lot of people out there that do not have health insurance, so we want to help them navigate the process a little bit. Or if they want to just come and ask questions, we have some local insurance agents that will be on hand there. We'll help them sign up or answer any questions they might have.
And that might be part of people's problem for not doing is they just don't really know where to start.
Absolutely. And a lot of people are not comfortable getting on the computer or whatever. So we'll be glad to help them.
Yeah. Now it's a requirement that you have health insurance now. And are they? Did I hear that they're going to start penalizing if you do not sign up by a certain time?
There's an opportunity right now. Well, folks can sign up, obviously, at our event, but this is the first year that penalties are going to be escalating.
Okay.
And they'll range from $691 a person up to maybe $969 a person based on the part of the country you're in. It's really, it could decimate somebody's tax return.
Definitely.
Sure. Yeah.
So it's going to be it's going to be important for people to plan ahead on this. And I think it's really important to take a step back and remember how this all got started. When the Affordable Care Act was passed in 2010, the design was to take funds from reimbursement to physicians and hospitals from Medicare to create a pool of dollars to be given to the states to expand Medicaid. And what's happened in Arkansas is that the first event was called a private option. The private option is funded through the end of December of 2016. And I noticed on the internet this morning that the legislative committee who was charged with the responsibility of coming up with a different plan after December of 2016 has given their report to the governor. So we'll see what's in that report, but I think it's important that the private option remains because what's happened at the hospital is that there are a lot of folks in our community who have signed up, and these were patients that we were caring for anyway. So our charity care, or our self-pay is what we call it, that's for folks who come to us who have no means to pay for their care.
Is that where this pool of money comes from to help with that?
Yes, it does.
Yeah.
It was primarily designed to expand Medicaid in many states. However, there are a lot of states around us that have not expanded Medicaid. Oklahoma has not, Kansas has not, Missouri has not.
Is it because they don't have the money there, or is it?
Well, I think there's a real political aspect to this, and I think that the expansion of Medicaid for hospitals really props them up in an environment where dollars have been taken away. But there are states who do not believe that the Affordable Care Act is something they want to participate in. Now, there's more than $125 million flowing into the state of Arkansas from this fund to be used to pay for insurance. And our self-pay numbers have dropped from about 9.5% of the people who are coming to see us down in the 3% range. So there are a lot of people who have availed themselves of this in our community.
Okay. When you say private option, what is that for somebody that wants to get their own insurance, or is there an insurance that comes from the state that they can opt into?
Actually, the private option is a term for a process in which someone who qualifies for expanded Medicaid in the state of Arkansas, that's up to 138% of the federal poverty level, can get money from the state to pay for premiums and get insurance off the federal insurance exchange. So a person can come in and sign up. We'll provide them an opportunity, and based on their income, then they can get a subsidy up to actually 400% of the federal poverty level. And that means that there are folks the working folks out there who do not have insurance through their employer can get subsidized for an insurance plan off of the federal exchange. But also those folks who, Medicaid traditionally covered folks at 17% of the federal poverty level and below. Now, if you think of 138% as $16,000 a year, 17% is a small number. Now we're funding insurance through this private option up to 138%, or about $16,500 per one person, around $33,000 for a family of 4. So it's a tremendous opportunity for people to get health insurance.
And then people that have private insurance, that really doesn't, any of this doesn't affect them.
Well, it can. If you are a working individual whose employer does not provide health insurance, you can go out to the insurance exchange and based on your income,
Up
get
to
a
400% of it.
which is, if it's about $97,000 for a family of 4. So you can get a subsidized insurance plan off of the Federal Insurance Exchange.
That
There's-
will help you pay your monthly
Exactly.
premiums, your co-pays, all of that.
Okay.
So it's really, it's designed to take, it's not new money for the industry. It's money that was removed from Medicare, which was pooled and then given back to the states to expand Medicaid. And many hospitals, now our hospital's percentage of Medicare is about 50%. So 50% of the folks who come see us are bringing a Medicare card. And the private option, or now the governor has changed that term to Arkansas Works. And that's what's going to be called after December of 16. So it's going to be interesting to see what the changes are within that. There is some indication that traditional Medicaid would be moved to a managed care environment. Now, that means that there would have to be pre-authorization for a number of things, and it could be a little tougher for folks to get things done. It'll be tougher for hospitals and doctors to be able to care for those folks because they'll have to be pre-authorized to do that.
Right.
So it's going to be, we'll study this over the next few months, and we'll see what the legislature actually enacts. But as we know it today, the private option goes away in December of 2016, and we'll see what happens after that. But I hope that there is enough folks who have prepared themselves to understand this plan so that it does continue in some form.
But the push now is to educate and get people signed up
Exactly.
either under the private option or other, whatever suits them or whatever they are categorized under.
Right now, if you don't have an insurance plan through your employer and you can't demonstrate when you file your tax return that you have health insurance, you're going to be fined. And that fine, if you have a return, will come out of the return. And if it does, if you don't have a return, they're going to send you a bill.
Oh, yeah.
Wow.
And it is an incentive for people. And if you think about it, the fine between $600 and $900 is enough money to pay premium for several months.
Yeah.
So
Or 2.5% of your household income, whichever is greater. So, it could even be more than
Wow.
what
Yeah.
Vince has said. There's been a lot of people that have taken advantage of this. I think there's like 247,000 in Arkansas. So it's been a wonderful thing for people that have never had access to care before.
Yeah.
They can now have insurance and see their doctor about things that they've had to live with.
the plan has moved folks from coming to the emergency room for primary care to now having an insurance card they can go schedule an appointment with their doctor.
Right.
So it's been a transition.
Everyone needs health care. I mean, it's an emergency, or even if it's not an emergency. You said the private option will be done away with at the end of December 2016.
The private option and the legislation that we know today will expire at the end of 2016. And the governor he set up a committee of legislators to come up with a new plan to begin then.
So there's hopes of having something similar, or maybe calling it something else, or
I
reworking
think-
it somehow.
From what I've read in the reports that we see, the odds are there will be a plan. We just don't know the mechanics
Yeah,
of that yet.
yeah.
It is likely that participants will have to pay a premium at some level. They may have to pay some co-pays, which they haven't in the past. I've read a couple of excerpts from articles about a lockout period, that if people are not paying their premium, they'll be locked out of the plan for up to 6 months, which could be kind of catastrophic for someone who has a problem during that 6-month period. But it really is an opportunity for us with the professionals that we have there to provide education to folks so they can make educated decisions about what they want to do.
Okay. But the most important thing now is to educate people, let them know about this January 12th event.
And where, and tell us a little bit
It'll
about
be
that.
in the first floor tower waiting room at the hospital. All you have to do is walk in, and there will be insurance agents there to help everyone.
So we encourage everyone to come out. We've held one every month during the open enrollment here, there at the hospital. But we really want to encourage people, like I say, even if you just have questions
Okay.
or if you need help getting signed up, we can do it right there on the spot.
Okay, and insurance agents there, they can sign you up if they want to, but if you just want information, you can come and get whatever information you need, whether you sign up or not, right?
Absolutely,
Or you have
absolutely.
someone else or
Or
another
they can
agent you want
call,
to go to.
if they have just questions, they can call me anytime at
Okay.
414-4142, and I'll be glad to help.
You
where I
might get
can.
your phone ringing off the wall.
I might, that'd be great.
All right. We appreciate you being here. Is there anything you want to add to
Anything
that?
else that
I'll
Yeah.
just thank you for inviting us to do this.
Absolutely. We hope that
Absolutely.
people out there will take advantage of this. If you've never had health care, don't be afraid. This might be the opportunity that you need to get started, and everybody needs great health. And we
Absolutely.
appreciate you very much for being here.
Thanks.
Thank you.
Up next, we'll be talking with Thomas he's the hospice director at the grief, and he's going to be talking about grief during the holidays. We'll be finding out all about that in just a few minutes. Stay with us.